Hello, and welcome to Nursing Research Tips, a show dedicated to sharing best practices, tips, and other resources within the areas of nursing research and evidence-based practice. I'm your host, Jenny Barrow, Associate Professor of Undergraduate Nursing, who specializes in teaching students real-world content to help transform their future nursing practice. I enjoy taking the boring world of research and EBP and making it come alive for my students. And that's exactly what I intend to do with this podcast as well. On today's episode, I have some special guests from my university's undergraduate nursing research and EBP course. Samantha Ashford, Ellen Duhon, Mallory Marcantel, Emily Naquin, and Hannah Underwood are joining us today to discuss their evidence-based practice project. Before they get started with their discussions, I want to let our listeners know that I have shared a copy of these students' EBP poster that accompanies this podcast episode. You can find this resource in the show notes in whatever type of podcast platform you're currently listening to. Now, without further delay, let's turn the show over to Emily to get us started.
Hello, listeners. My name is Emily Naquin, and on behalf of my other group members, I would like to welcome you to our podcast discussing the work we have completed in our undergraduate nursing research and evidence-based practice course. The title of our presentation is Effects of Nurse-to-Patient Ratios on Patient Mortality Rates. And the members of our group include Samantha Ashford, Ellen Duhon, Mallory Marcantel, Hannah Underwood, and me, Emily Naquin. We are all undergraduate nursing students at McNeese State University, located in Lake Charles, Louisiana.
Thank you for introducing your team to our listeners, Emily. I'm excited to hear more about your group's topic and to hear from each of your group members as we continue with today's episode. So let's not delay this any further. Ellen, can you tell our listeners about the topic your group selected for your EBP project and why your group felt that selected topic was important to the nursing profession?
Hello, everyone, and welcome to our discussion on an issue that has been at the forefront of nursing and healthcare for years: nurse staffing, and more specifically, nurse-to-patient ratios. Our group selected this topic because nurse staffing levels play a critical role in patient safety, quality of care, and overall patient satisfaction. As future nurses, we recognize that inadequate staffing is not just a challenge for healthcare workers, but is a serious risk factor for patients as well. When nurses are stretched too thin, the quality of care can decline, leading to preventable errors, increased stress among healthcare providers, and ultimately worse patient outcomes. Nurse-to-patient ratios refer to the number of patients assigned to a single nurse during a given shift. When these ratios are too high, meaning nurses are responsible for more patients than they can effectively manage, it can have serious consequences. Research has consistently shown that excessive patient loads contribute to nurse burnout, increased medication errors, and decreased time spent at each patient's bedside. These factors don't just impact nurses, they directly affect patient satisfaction and more severely increase the risk of poor health outcomes, including prolonged hospital stays, higher infection rates, and even higher mortality rates. The issue of nurse staffing is one that affects hospitals across the United States and the world. Hospitals have long struggled to balance financial constraints with safe staffing practices, leading to variability in how nurse-to-patient ratios are managed. Recognizing these concerns, California became the first state in 1999 to implement mandatory nurse-to-patient ratio laws, requiring hospitals to maintain specific staffing levels to ensure patient safety. Since then, other states have debated or enacted similar measures, but there remains significant variability in how staffing ratios are regulated across different healthcare settings. While these policies aim to improve both nurse workloads and patient care, the true impact of nurse-to-patient ratios on patients' outcomes remains a critical area of research. This is an important topic for the nursing profession because nurses serve as the forefront of patient care. When nurses are overworked, they experience higher levels of fatigue, stress, and dissatisfaction, which can lead to increased turnover rates and a worsening nursing shortage. This creates a dangerous cycle in which inadequate staffing further strains the remaining nurses, leading to unsafe conditions for both healthcare workers and patients. Additionally, with an aging population and increasing demand for healthcare services, Ensuring that hospitals maintain safe nurse-to-patient ratios will be more critical than ever in the coming years. Given the significance of this issue, our research aims to explore the relationship between nurse-to-patient ratios and patient mortality. This brings us to our evidence-based practice question.
Thanks for explaining some key background information about some of the negative aspects of having inappropriate nurse-to-patient ratios, Ellen. You mentioned several consequences for both patients and nursing staff related to inadequate staffing. And I appreciated your brief background discussion on how some states have taken legislative action to help remediate unsafe nursing staffing in hospital settings. So, Ellen, can you tell us what your group did next within this overall evidence based practice project?
Now that we've established the importance of this issue and its relevance to the nursing profession, I'd like to introduce our group's evidence-based practice question, which guided our research. In order to examine the relationship between nurse-to-patient ratios and patients' outcomes, we structured our question using the PICO format, which helps frame clinical investigations by identifying the key components of population, intervention, comparison, and outcome. For our research, the population consists of patients in acute care hospitals, a setting where nurse staffing levels can have a direct impact on patient safety, recovery, and overall care quality. The intervention we are investigating is lower nurse-to-patient ratios, meaning fewer patients assigned per nurse, which is hypothesized to improve patient outcomes. The comparison group consists of higher nurse-to-patient ratios, where nurses have heavier workloads with more patients assigned to them. Finally, the outcome we are analyzing is patient mortality rates, which serves as a critical measure of overall patient safety and the effectiveness of care. With these components in mind, our final research question is, in acute care hospitals, how do lower nurse-to-patient ratios compared to higher nurse-to-patient ratios affect patient mortality rates? By addressing this question, our goal is to determine whether lowered nurse-to-patient ratios contribute to better patient survival rates and improved healthcare outcomes. Through an analysis of existing research, we hope to provide evidence that supports safe staffing policies, ensuring that hospitals prioritize both patient safety and nurse well-being as the nursing profession continues to evolve. Understanding the impact of nurse staffing levels on patients' outcomes will be essential in advocating for evidence-based changes in healthcare policy and practice.
Thanks for sharing your group's PICO question with our listeners, Ellen. This question served to focus your group's investigations into the literature. Can you tell our listeners more about how you used that PICO question to help you find published research studies on your selected topic?
For our literature search strategies, we used our group's PICO question to create keywords to search the university's library databases. The databases that we searched consisted of PubMed, CINAHL Complete, HealthSource Nursing Academic Edition, Academic Search Complete, and Psychology and Behavioral Sciences Collection. Some of the keywords that we used for our searches included nurse staffing and mortality, nurse-patient ratio and mortality, nurse-to-patient ratios and patient mortality, patient outcomes and nurse staffing and hospitals, and last but not least, we used lower nurse-to-patient ratio and hospital outcomes. We set specific search limiters on our searches. This included peer-reviewed, academic journals, published between 2020 and 2025, and nursing journals. Our literature search went smoothly once we got the hang of using the right keywords and search filters. At first, we had trouble finding articles that were relevant to our topic, but narrowing our searches made a big difference. This helped us find relevant studies quickly. Checking the reference list of helpful articles and using the advanced search options seemed to be helpful for our group. We also found that choosing specific criteria like study type and publication date made it easier for us to identify the most relevant studies. We saved so much time and effort because of it.
I appreciate your sharing some helpful insights into your group's literature search process, Samantha. I'm glad your group learned some valuable lessons for how to more efficiently navigate and retrieve evidence from professional databases. Many hospitals offer access to nursing and healthcare databases to their staff nurses as part of their employment benefits. I love when I hear the hospitals are doing this because we desperately need to ensure that the nurses who have so much responsibility and accountability for providing safe, effective care have all the tools at their disposal to help them do just that. It just makes sense that direct care nurses need to be able to access the best available evidence to help them provide the best possible care to their patients' diverse care needs. Now, after your group retrieved and reviewed these peer-reviewed studies, what kinds of evidence did you find pertaining to your group's PICO question?
After we conducted our literature search through McNeese's library database using the methods previously described, we analyzed several study articles in order to find high-quality studies that were directly related to our evidence-based practice question. Once we narrowed our selection of articles down, each group member individually appraised one study article of their choosing. We then took our results and gathered them together in one group synthesis table. This allowed us to get a better picture of the current state of the science surrounding our topic. All of the studies that were critically appraised by our group members were performed on adult patients in hospitals outside of the United States. Yes, a population of adults is very broad, but the population being restricted to adult ages does ensure that factors uniquely associated with pediatric patients would not skew data. However, the fact that all studies were done in different countries may introduce confounding variables that had the potential to impact the data collected in these studies. Regarding our article study designs, majority of the studies used in our group synthesis table used a retrospective or prospective study design. Both of these study designs are categorized as observational. And with observational studies, it can be difficult to confidently determine causal relationships between variables utilized in a study. Because of this, the use of these specific study designs could be viewed as a weakness of these studies. Each study detailed in our group synthesis table used either nurse-patient ratios or hours worked per patient day, which was abbreviated as HPPD, or both as at least one of their independent variables. A higher nurse-patient ratio in these studies denoted more patients per nurse, and a lower nurse-patient ratio denoted less patients per nurse. Regarding dependent variables, each study analyzed patient mortality rates as at least one of its dependent variables. So clearly, all of these studies were attempting to determine the relationship between the amount of patients a nurse had on their plate and the number of hours they worked a day and the rate of patient deaths. The majority of studies analyzed by our group members came to the conclusion that the following factors were found to be associated with a decreased incidence of patient mortality. These factors are lower nurse-patient ratios, meaning less patients per nurse, a higher average hours worked per patient day, and higher levels of nurse staffing. These results highlight the importance of having a safe nurse-patient ratio, adequate nurse staffing, and appropriate hours worked by nurses when it comes to reducing mortality rates in patients. One article that was reviewed by our group members actually included results that showed a correlation between low nursing staff levels and increased mortality rates and an overall decreased patient safety. This result emphasizes the importance of adequate staffing in regards to patient outcomes that we saw in the other articles just discussed. All of these pieces of key evidence allowed us as a group to get a good picture of the strengths and weaknesses of our chosen studies. These pieces of key evidence also allowed us to come one step closer to finding an answer to our proposed evidence-based practice question.
Excellent discussion of the studies that your group reviewed, Mallory. It was interesting that none of your studies in your literature review were conducted in the United States. You correctly mentioned that this factor may serve to limit the generalizability of your findings and the implications from this EBP project. Because your group's project is a literature search process with a very limited scope, this was by no means a comprehensive, systematic literature review. Out of necessity to keep your workload manageable in the midst of an otherwise hectic semester of nursing school, I only have these EBP work groups review one study per student. However, I want all of our listeners to know that in the real world, apart from these limited scale assignments like this, nurses need to conduct much more thorough reviews of the published literature. If that would have been done in this project, I'm sure your group would have retrieved studies from more diverse groups for more generalizable implications. The goal of this project is not to provide a systematic review of the published literature surrounding a topic of interest. Instead, the focus of this particular project is on teaching undergraduate students, through hands on real world practice, how to be a knowledgeable consumer of research. To be a knowledgeable consumer of research, you need to know how to find research evidence, read it and understand it, critically appraise the studies for strengths and weaknesses that impact their usefulness to clinical practice, and ultimately determine potential clinical significance after reviewing a larger body of rigorous, high quality evidence on the same topic. That last step that I just mentioned actually is moving toward creating evidence for practice, which is a higher order research and EBP competency that is typically the foundation for beginning research and EBP investigations at the graduate education level, not the undergraduate level. All of that notwithstanding, your group did a great job investigating the literature and critically appraising it so that you could gain a better understanding of what the science says about a topic of interest to the nursing profession. Now, Samantha, can you tell our listeners about some additional key implications that nurses and nursing administrators who work in acute care hospital settings should consider based on the literature that your group reviewed?
Based on the information our group reviewed, we found some key implications for nursing practice that can really make a difference in patient care and nurse well-being. The first important point is that nurses must advocate for nurse-to-patient ratios that are reasonable and ensure that staff is based on the most recent evidence-based practices. Correct staffing allows nurses to focus more on each patient, which reduces mistakes and improves outcomes. This is important in high-stress environments like the ER and ICU. We also found that proper workloads are essential for patient safety. The chances of mistakes and complications can increase when nurses become overwhelmed with too many patients. This is important in specialties where patients tend to require additional care, such as pediatrics, geriatrics, and even oncology. Hospital policies can help lower these risks and help improve the treatment provided by managing the workload put on each nurse. Lastly, creating a healthy work environment is crucial. Using coping strategies and identifying stress early on can help avoid burnout and increase job satisfaction. This is especially important in fields that move quickly, like emergency and critical care units. In a welcoming environment with supportive staff, nurses are able to care better for themselves. This can then lead to a more effective care for patients under their supervision.
Thanks, Samantha. You provided our listeners with some helpful takeaways for how nurse to patient ratios need to be individualized based on patient acuity and also the overall clinical specialty. So, Emily, did your group find that there are any gaps in the present literature that may require further research investigations in the future?
There are still some knowledge gaps remaining in the published literature surrounding our topic. Therefore, our group did develop some implications for future research. Our group developed the implication that future studies should consider focusing their research on providing an optimal range of appropriate nurse-to-patient ratios that would provide the best possible outcomes for many different patient populations. We know that populations can be small or large and consist of many different types of patients, such as elderly, all the way to pediatrics. For those reasons and many more, there cannot be a one-size-fits-all nurse-to-patient ratio that will be beneficial for everyone. If researchers decide to perform future studies to provide an optimal nurse-to-patient ratio, there should be a range that can consider many different populations.
Okay, so your group has given us a lot of excellent information about the current state of the science surrounding your selected clinical practice topic. After all of the research studies your group reviewed, including considerations for study weaknesses and the continued gaps in the present literature you just mentioned, what was your group's overall literature based answer to your original PICO question?
After all of the research studies that our group reviewed, we were able to determine an evidence based answer to our EBP question, which Ellen presented to you all previously. The evidence strongly indicated that higher nursing staff levels consistently contributed to better patient outcomes. The main outcomes in focus were patient mortality rates. These rates were lower with higher nurse staffing, meaning that lower nurse to patient ratios led to lower patient mortality rates in acute care settings and hospitals. Furthermore, improved nurse staffing not only reduced patient mortality rates, but it also contributed to better patient satisfaction, shorter hospital stays for patients, and reduced readmissions. Lastly, the increased staffing or lower nurse to patient ratios were found to decrease the likelihood of nurse burnout. This alone improved the quality of care, which in turn reduced readmissions and lowered the risk of unplanned deaths. Both hospitals and specific care units with more favorable nurse staffing ratios saw considerable improvements in patient outcomes, emphasizing the importance of adequate nurse numbers to ensure quality care. These results strongly advocate for hospitals and nursing units to prioritize maintaining and improving nurse staffing levels. Ensuring that adequate numbers of qualified nursing staff are present can significantly reduce patient mortality and improve patient satisfaction. It will also decrease the likelihood of nurse burnout, which will lead to better and safer quality of care from the nursing staff. Given this positive correlation, hospitals should consider implementing adjustments to ensure staffing policies promote and achieve optimal nurse to patient ratios. Ultimately, improving nurse staffing levels is a critical investment that can lead to better health outcomes for patients, or lower mortality rates in this case, greater job satisfaction for nurses, and better patient outcomes overall. It is important as nursing students and future RNs that we recognize the importance of EBP and nursing research. Having access to research and studies can help us all in our careers as nurses. In learning from those that have been in the shoes we will be in, and in reviewing their research and findings, we can learn how to do various things better and contribute to better overall outcomes in our profession. This can be under a vast majority of subjects, and it can help us in ways that are limitless. This study alone could significantly help us in our future careers as RNs. If we ever plan to become charge nurses, nurse managers, or even move into more of a corporate position in nursing, the outcomes we learn through this study could help guide us in numerous ways. It could help us in improving staffing based on the knowledge we gained, and now knowing that lower nurse-to-patient ratios have a multitude of benefits for not only the nursing staff and our hospital organization itself, but more importantly, for our patients. Thank you all for your time.
Thanks for wrapping up your group's discussion, Hannah. I'm proud of each of you for integrating the content that we've discussed in our undergraduate nursing research and evidence-based practice course into this real-world literature search process. It seems that your group found multiple benefits of improved nurse staffing, not just with regard to your group's primary outcome, which was patient mortality rates. There were lots of improvements in patient and nursing outcomes in the literature you reviewed. Making improvements in staffing will absolutely affect the overall nursing budget, though, and the role of nursing administration in this area cannot be understated. Some of the students in your group could actually become nurse administrators in the future. You'll see the difficult tightrope that administration must walk to keep nursing stakeholders happy, patients satisfied with positive outcomes, while also being mindful of the hospital-wide and the departmental-specific budgets. It's not an easy feat to accomplish. However, being informed by high-quality, rigorous research studies that show such conclusive correlations between staffing and these positive outcomes serves as the impetus for making sure we are providing the best staffing possible in acute care hospitals. As Dr. Marian Turkle stated, nurses are practicing caring in an environment where the economics and cost of healthcare permeate discussions and impact decisions. At this point, I'd also like to thank our listeners for going on this journey with us. We hope you're walking away from this episode with a greater understanding of some of the behind-the-scenes importance of why staffing can be a challenge and why nursing staffing rates are so important to improving overall patient and nursing outcomes. Thanks again for joining us today.